Yeah, Oasis 4 was a randomized placebo-controlled clinical trial, really looking at efficacy and safety of an oral preparation of semaglutide. Semaglutide being a peptide that agonizes GLP-1 receptors. There's GLP-1 receptors in the brain, and this suppresses appetite and promotes weight loss versus placebo. And this study was conducted for over a year. And the semaglutide treated group, the oral medication, these people lost close to 15% of their body weight and much greater than placebo. And this was associated with other metabolic benefits in terms of lipids and blood pressure and glucose, quality of life, and physical activity. So we viewed this as a very positive outcome. Yeah, the injectable version was approved for obesity in 2021. If approved, oral semaglutide 25, which was studied in Oasis 4 trial, would be the first oral medication of a GLP-1 based medication that would come to market. So it would be the first oral pill using this very powerful target for appetite suppression. It is nearly really approximate efficacy with the injectable version without any more side effects. So this gives patients an option, really. If they prefer to take an oral medication, it's there. If they prefer a once-weekly injection, that's there as well. You know, we need patients to stay on these medicines for decades, really, because this is obesity is a chronic disease. And leads to complications that impair quality of life and confer, you know, morbidity, mortality. These are what make people sick, and this is what, as healthcare professionals, this is this is what we want to treat. So patients need to stay on these medicines to kind of to maintain the health benefits of the weight loss. And if they prefer an oral preparation, now it's available, and that should be associated with greater adherence and persistence on the medication for people who do prefer the oral medication. Yeah, well, the oral eliminates any local reactions at the injection site, but generally speaking, the side effects are similar. They both mediate their efficacy through binding this GLP-1 receptor and suppressing appetite. These receptors are also in the brain and kind of can cause nausea as well. So the main symptoms are gastrointestinally related. Those include nausea, some vomiting, diarrhea, and constipation. These side effects are generally, you know, rated to be mild to moderate, and mostly they're during dose escalation phase. Patients have to be started at a low dose and then every 4 weeks increased to the maximal dose. And that's when the side effects occur and then get better over time. It's unusual for these side effects to result in the need to discontinue the medicine. So, and only 40% of people have these symptoms. So most patients do pretty well. The injectable is 2.4 milligrams a week. Okay, started lower doses. You know, started at 0.25, in fact, and then moved to 0.5, and then 1.7, 2.4 over each escalation being lasting a month. But the maximal dose is 2.4 milligrams. The dose in Oasis 4, the oral semaglutide, is 25 milligrams. So it sounds like 25 is a lot more than 2.4, and it is. But not all of it is absorbed into the bloodstream when you take it orally. So the actual dose is similar in terms of what the body sees. But those are the differences in the dosage. You know, injectable versus oral, this, in my opinion, this basically comes down to patient preference. They're both effective. They both have the same side effects. Both tolerated just as well. They both achieve similar efficacy and counteract all these complications and related diseases that are associated with obesity. So to me, it just gives us another arrow in the quiver, if you will, that we have to treat patients. Again, a preference for oral medications, it's there. If you would rather the injectable once a week, that's fine also. So I just view it as a patient preference issue. Yeah, this is fairly standard in these obesity trials. Patients had to have a body mass index of 30 or above, or they could have a body mass index of 27 to 29.9, a little lower than that 30 threshold, if they had at least one obesity-related complication. This could be prediabetes, this could be sleep apnea, this could be abnormal lipids, this could be a higher blood pressure. And so these were patients without diabetes in this trial. So those were the inclusion criteria. You know, we as clinicians are really looking forward to FDA approval, which could occur by the end of this year or early next year. And with this medicine gets out into the pharmacies, we can prescribe it and give patients this option, this oral option, and help maintain greater adherence to the medication in those patients who prefer the oral options. So this is exciting to us. It's the first oral GLP-1 based medication that would be available to treat obesity. Yeah, it's been an honor and pleasure for me to be in the diabetes and obesity field in my career. And in the past 15 years, I've become more passionate about obesity, of course, which is highly related to type 2 diabetes. But we're living in an era of medicine development for obesity that's really unprecedented. And the way we consider obesity, not as a lifestyle choice, but as a disease, attitudes have changed over the past decade even, based on data and a greater understanding of what causes obesity. And the advent of these GLP-1 based medications just offer unprecedented efficacy and safety for treating this disease. We've never had tools like this before. So this is exciting for me to be in this era. I really view it as a landmark in the history of medicine, perhaps on par with the discovery of insulin, discovery of penicillin, the polio vaccine, things like that, given how the capacity this gives us to treat this disease effectively and the patient suffering and social cost of this disease, which are so widespread around the world. So I just view this, I'm lucky to be working in this area. And this new oral semaglutide, just as I said, gives us another tool to use and as we individualize care for these patients.